Hi, it's Elrina from Fleet Physio and Wellness, and you will have had your pelvic floor exam today and been told that you might have some tightness or some painful points in your pelvic floor. The pelvic floor should act as a nice supple trampoline, so it should be able to expand and contract. And we normally look at that expansion and contraction as about 10 levels up and down. And normally the expansion will happen on the in-breath and the contraction will happen on the out-breath. And that happens quite naturally as we breathe in and out because of the fascial connections between the diaphragm and the pelvic floor. But sometimes what happens is we've had injury or tightness or scarring or whatever's happened, even maybe some issues with a hip or a lower back. And sometimes one side of the pelvic floor can be held quite tight, or maybe even both sides are held tight. So instead of being down to 0 when it's relaxed, it could be held at like 3 or 4 or 5 out of 10. So it's important to make sure that that pelvic floor is releasing all the way down to 0 and able to contract all the way up to 10. And our resting tension tends to be around 3 or 4 just in activities of everyday living. So if I've told you that you have tightness or maybe even some hypertonicity, which means short and tight pelvic floor, then I would have asked you to do some release work on the pelvic floor. So what we normally do is use the opposite thumb on the opposite side, so right thumb to left and left thumb to right, to release the pelvic floor. So, and you can ask your partner for help with this as well if you find it quite difficult to negotiate. The best place to do this would be in the bath where your knees are supported and your back is supported and you're in a rounded position, or even in bed when you've got yourself supported with some pillows behind your back and maybe some pillows underneath your knees. So if we look at this model here, we have the two openings, the vagina at the front and the rectum or anus at the back, and you've got the slings of muscle of the pelvic floor, the levator ani there, and it's two muscles, and then the muscles that sit further to the side. So obviously this is bent in like so. So when you do release work, you'll be using your thumb coming to the opposite side, and you can do some release work all the way, just dragging your hand along the fibers or possibly getting into the deeper tissues over there if you can reach, and then using the other thumb to release the other side. If your partner's doing it for you, they can just use an index finger coming in and feeling across and feeling if both sides feel the same. Do both sides, when you breathe in and out, do they feel the same? Is there the same tension held? Are there some spots that feel quite sore? And we tend to look at this as a clock, 12 o'clock at the top and 6 o'clock at the bottom, and then 3 and 9 to either side. And I might have said to you, you've got some tender spots around, 2 o'clock or 10 o'clock, and all the way around that you can do some release work. When you are holding a point, a trigger point, you can expect some referral from it, maybe referring into your buttocks or referring into your lower back or your hip, or just deep into your sort of groin area as well sometimes. And that's pretty normal. But what you want to do is make sure that that discomfort you feel is never more than 3 out of 10. And you're never going to do this more than 3 times a week. So you give the tissues a chance to recover from the release work. And you don't do it for more than 3 minutes. So a little rule of 3 there, 3 minutes, 3 out of 10, discomfort, and 3 times a week. So just give you an idea of how that's done, easy peasy. Now, if you're finding that really hard, there are some tools in the market. The one that I tend to recommend is the Easy Magic, but there's another one in the market called the Thera Wand. Whichever shape you feel is better for you. And that's what it looks like. You use the round edge because it's actually it's a bigger surface area, so it's not as uncomfortable. But I'm going to show you with the other edge because obviously my model doesn't allow for the space. So you'd be holding that in your hand, but you'd have a lot more play in terms of how deep you can reach and which muscles you can get to when you're releasing. The pressure being very gentle. If you feel the referral, that's deep enough. And then obviously holding with the other hand or even the same hand, but just working around to the other side. And being careful not to bruise yourself. But the joy of having a tool is that you can make it really cold if you feel hot and inflamed internally. So you can keep it in the fridge or put in some cold water, or you can warm it up and have it in a cup of warm water so that it's nice and relaxing while you're doing your release work. It's worth it. It's really actually quite easy to treat unless there's some other issues around it. But for the most part, I find releasing that pelvic tension, connecting that with the breath, breathing in as you do the release work, and releasing your pressure on the spots you're working on your out breath, so you don't have that tension through the tissues. I hope that all makes sense to you. If you have any questions, ping me a text or an email, and I'll try and clarify that for you a little bit more.